Today we are going to give a brief overview of Taiwan and their healthcare system. Taiwan is a small island off the coast of China, and it's about a third of the size of Kentucky with a population of 23 million, which is about 5 times more than Kentucky's population.
To start off, key information about the healthcare system in Taiwan is that the Taiwan healthcare system is known for being a mix of Western and Chinese medicines and having good accessibility, comprehensive population coverage, short waiting periods, low cost, and a national data collection system for planning and research. However, some cons to the healthcare system include short consultation times, poor time management of specialist services, concern about quality, and increasing financial pressures. Taiwan has a national health insurance system that was introduced in 1995, and it is a government insurance-based national health care that is a single-payer system.
Taiwan has what they call NHI, or National Health Insurance, which is a government-run single-payer universal health coverage for Taiwan citizens, and this is what funds their health care. It covers outpatient visits, inpatient care, dental care, prescription drugs, and more. Every single citizen of Taiwan gets this insurance. Secondly, the access to healthcare in Taiwan is very easy. There are over 11,000 clinics, practically one on every street corner, according to Dr. Ming, who grew up in Taiwan. Also, there are over 500 hospitals. Finally, there is no financial barrier to access healthcare because everyone receives the national health insurance.
What is the training for healthcare professionals? What does it consist of?
Yeah, it's a good question. It's slightly different. In Taiwan, the medical school start at undergrad. So for example, when I was in high school, we have different track we can choose. So I choose engineering track, as you can imagine, and my classmates they choose medical school track. So they have those biology course and chemistry course more. Then we have entry exams to college. And after that exams, they pick their school programs to go to. Depends on their score, they fall to different school. But the medical school start at undergrad first year, then go all the way to 7th years. So their undergrad is seven years. So I think also first 4 years are more classroom learning, and the last 3 years the internships kind of at the hospital. But then after that, they will also do 2 or 3 years in fellowships, kind of residency kind of things.
The inhabitants of Taiwan mostly were immigrants from China. As a small island, they were faced with the dilemma of staying technologically up to date and being competitive with other countries. Taiwan, however, was determined to become a technologically literate country and competitive with other countries. The country began to industrialize during the 1980s, and as a result, had one of the world's worst healthcare systems. Taiwan was ranked even lower than the United States. More than half of the population did not have any means to access healthcare, and Taiwan wanted to change that. By 1995, Taiwan had a new healthcare system made from scratch. They decided to pick and choose different parts of healthcare systems from about 10 other countries around the world in order to create their healthcare system. The government wanted to keep their population happy, especially with a low cost of the healthcare. To keep their healthcare low in cost by regulating the cost and keeping GDP around 6.2%. The overall health of the population in Taiwan is very good. The life expectancy of women in Taiwan is higher than the women in the US and other countries. The lifespan of males, however, is about the same for men in the US. They have a lower infant mortality rate, lower than heart disease rates, and spend about 10% less than their GDP on health care compared to the United States. They do face some challenges, though, such as nurse shortages and the shortages in pediatrics, surgery, and emergency medicine. Another downfall is that the healthcare system is costing Taiwan's government more than the population is paying. This is a graph from Dr. Ming's presentation showing life expectancies comparing men and women's at birth in Taiwan. Women's life expectancy is approximately 81.9 years, and a men's life expectancy is approximately 75.6 years.
The healthcare system of Taiwan is very good overall and it is very efficient. The NHI gives consistent access to healthcare and access is easy with clinics on almost every street corner. But there is room for improvement. Taiwan lacks healthcare professionals in primary care, pediatrics, and emergency medicine. The government has acknowledged the problems within their healthcare structure and they are making strides to improve these struggles.